Part of where this was coming from, and the other piece was that there are some hospitals now around the world that have really can match like for like with manufacturing in relation to applying lean, and so I thought I'd give you some insight to some of them and some of the lean projects we've done ourselves along the way. This guy, David Fillingham, was the CEO of Bolton Hospital, and it's one of the hospitals in the UK that applies lean and value stream, and they have actually got it to a fine art where they every 3 months they do a report out. They charge 100 sterling and they allow a certain amount of people to come along and hear the report outs, mainly from Kaizens, and they would do 5 Kaizens at a time, and it's right across the organisation. So in the introduction to his book, this is what he says: when compared to many other sectors, healthcare is at best seriously underperforming, at worst it's a failing industry. Nice to hear. And across the world, healthcare systems are serving their customers poorly, have demoralised staff, and are providing their funders with poor value for money. And usually what we cite here is the 14% of GDP that the US is using for healthcare. And as we all know, the number of people that are not covered in the States, and how costly it is to go into hospital. You nearly need to sell the house to go in for a week. Valiant efforts have been made to improve in many countries, but there have been some successes, but these have been marginal rather than transformational. Lean methodologies have revolutionised quality, profitability and staff morale in many businesses, we all know here, and outside of healthcare, and there's now a growing body of knowledge to say that it's impacting in healthcare as well. So when I would go along to sort of talk to people about doing lean or Six Sigma or otherwise, I get this sort of response: we're not Japanese and we don't make cars. So this piece is, you know, that hospitals are not factories and patients are not products, and, you know, we're not talking about widgets here, etc. And that it has its own unique set of issues, and that we need to be very careful with how we consider these. But at the same time, healthcare is a process, and all processes can be improved. A lean methodology can provide the deeper understanding of how value is crafted in a healthcare setting and how waste arises to the detriment of both staff and patients. And we'll all accept that there's a lot of waste in healthcare. We can emulate Toyota in creating a systematic framework for lean approach, and there are particular challenges, but there are challenges in every industry. And embedding lean is no different, I think, in healthcare than it is in any of your manufacturing. It's just a different culture. So if I was to look at the differences and similarities, caring for a patient is different than manufacturing project, but there's a process, and as I say, all processes can be improved. The demand for healthcare is totally unpredictable, and well, this is not true. You see, we have patterns of emerging demand that are highly predictable by the season. We know at this stage what we can expect in ED each day, every day, at particular times of the day, and bank holidays, etc. So there's a pattern also of elective demand. In other words, we know how many surgeries we're going to do. We have pre-booked it. So it is within our control. They also talk about, you know, the practice of medicine requires great judgment. We spent a lot of years training, and that you can't standardise that it's about a particular view that a consultant may or may not have around your condition. But medicine is a science, and research can determine best practice, and it has demonstrated that compliance with it improves outcomes. So a lot of the work that James Riley and the SDU, which is the Service Delivery Unit, are now doing around clinical programs across the country is about that. It's about what is best practice, and then getting people to follow that best practice and ensuring that compliance improves outcomes. And partly through that, we're getting a lot more of consultant staff. And I could be cynical and say whether that's good or bad, but there you are, that's what's happening. So the next piece of their argument would usually is that each patient is unique. This is true, but there are many things and a great deal in common. Analysis shows that 6% of common conditions account for 60% of the work done in healthcare settings. Furthermore, many patients, even though they have individual needs, flow through the same process, and that's sort of like what John was talking about this morning. And what we would call it in our industry is care pathways.